Okay, it seems most of our honorable speakers are already here. Thank you all for waiting. Let's get our event started. Okay. Assalamualaikum warahmatullahi wabarakatuh. Good,
Waalaikumsalam.
good afternoon. Welcome everyone.
Assalamu alaikum. Good afternoon.
Good afternoon. Thank you. Thank you for finding time and joining our international web conference sessions with the title of Learning from COVID-19 Experiences in the Asia Pacific Region, State and Society's Perspective. It is really with great honor. My name is Keisa Dinya, and I am your Master of Ceremony from NIPA School of Administration. Before we start, I would just like to inform all of you a brief overview of today's event. We are very thankful for your interest for this event. In total, we have received 1,720 submitted registration in over just 4 days. This event is an international web conference involving 6 Asia-Pacific countries with total of 500 participants from various countries in this Zoom meeting. Besides being viewed in Zoom meeting, this conference is also being viewed live in YouTube. Now I'm going to share you some rules for this web conference. First, to ensure smooth running of the event, all participants' mic will be muted, except for panelists and speakers. If you have any questions for the speakers, please drop your questions in the Q&A features. This is only limited for Zoom meeting participants only, so for those YouTubers, we are very sorry for the limitation. Kindly follow this event until the end, as we will give you link for attendance later to be filled. We will process e-certificate based on the attendants who have filled the form only. Now I'm going to read the rundown agenda for this conference. First one, at the beginning, we will have the ceremony by listening to the national anthem of Republic Indonesia. And then we'll have opening speech, which will be delivered by the Minister, Mr. Cahyo Kumolo, the Minister of Administrative and Bureaucratic Reform Indonesia. And then we'll have the photo session, and then panelist sessions guided by Dr. Cecep Effendi as the moderator. And then Q&A sessions also guided by the moderator. And last but not least, the closing. All right, now as an official ceremony to commence this program, we will start by listening to the national anthem of Republic Indonesia. To the IT team, please help to play the song. Thank you. Okay, now on behalf of the committee, I would like to give our very warm welcome to all of our honorable guests. Mr. Cahyo Kumolo, the Minister of Administrative and Bureaucratic Reform Indonesia. Thank you for being here with us, sir. His Excellency, the Chairman of National Institute of Public Administration Indonesia, Dr. Adi Suryanto. Then we have Dr. Cecep Effendi as the moderator for the panelist session from Muhammadiyah University Jakarta, who is also a former Director General of Sirdap in 2012 until 2016. Thank you, sir. And we have Professor Dr. Nurliah Nurdin, our own director from NIPA School of Administration Indonesia. And then we have Dr. Yang Hun An from Korea Research Institute for Local Administration, South Korea. And we have Dr. Vasanti Rajendra from Nepal. And we have Miss Eva Benita Tuzong from Ministry of Agrarian Reform, Philippines. And last but not least, Dr. Shabazz Hussein from Ministry Agriculture, Jihad, Iran. Thank you very much for being with us and making this event possible. All right, now without further ado, we will turn the time over to Mr. Cahyo Kumolo, the Minister of Administrative and Bureaucratic Reform, to deliver opening speech for this international event. To Mr. Cahyo Kumolo, the time is yours. Thank you.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Honorable Chairman of the National Institute of Public Administration and all staff, Honorable Dr. Yung Hon An from Korea Research Institute of Local Administration, South Korea, Honorable Dr. Durga Hoja, former Director General, Dr. Shabazz Hussein, Minister of Rural Development from Iran, Dr. Sampun Hanpongpan, Consultant and former Director General of Sidrap, Thailand, Dr. Eva Toson, Minister of Agrarian Reform, Philippines, Professor Nurliah Nurdin from NIPA School of Administration Jakarta, moderator yang saya hormati, distinguished guests, ladies and gentlemen. For speaker, if I use speak bahasa Indonesia, from now. Pertama, mari kita panjatkan puji syukur kehadirat Tuhan Yang Maha Esa, Allah SWT, atas limpahan karunia-Nya dalam keadaan sehat, walafiat, semangat, dan optimis menghadapi pandemi COVID ini. Kita semua bisa hadir dalam webinar internasional, Learning from COVID-19, Experience of the Asia Pacific State and Society Perspective. Saya menyampaikan terima kasih dapat diberikan kesempatan oleh lembaga administrasi negara. Dan saya menghargai inisiatif dari Politeknik STIA LAN Jakarta dalam menyelenggarakan seminar semacam ini. Inisiatif serupa juga sudah dilakukan oleh berbagai kalangan. Hampir tiap hari saya juga mengisi berbagai diskusi dan seminar, baik dari swasta, kelembagaan maupun kementerian-kementerian dan pemerintah daerah. Bagaimana mempersiapkan new normal, tatanan baru di dalam peran-peran seluruh stakeholder dan gerakan-gerakan dalam melawan COVID ini, sekaligus kita harus disiplin mengikuti protokol kesehatan yang ada. Sebagaimana kita ketahui bahwa lebih dari 216 negara di dunia sedang menghadapi COVID-19, termasuk Indonesia. yang berpenduduk 265 juta. Tidak hanya negara berkembang, tapi juga melanda negara-negara maju, seperti di Amerika Serikat, termasuk di sejumlah negara di Eropa. Data mengenai COVID-19 di Indonesia per tanggal 26 Juni ada kasus positif mencapai 50.000 orang. Dan sedikitnya ada 2.500 orang meninggal karena virus ini. Akan tetapi kita ingin terus-menerus berupaya agar tingkat kesembuhan ini akan bisa berjalan secara maksimal. Bapak Presiden Joko Widodo telah mengambil kebijakan dalam penanganan COVID-19 ini. Terdapat 3 aspek kebijakan yang diterapkan oleh Bapak Presiden. Yang pertama adalah menyangkut aspek kesehatan, health aspect. In the sector, we have taken broad scale of social distancing policy. Dalam bahasa Indonesianya adalah pembatasan sosial berskala besar. Hal ini sesuai dengan rekomendasi WHO untuk memutus mata rantai persebaran COVID-19. Semua negara wajib menerapkan social distancing dan physical distancing, dan kami tidak memilih untuk melakukan kebijakan lockdown. Kami masih memperbolehkan adanya aktivitas sosial terbatas, tetapi dibatasi ruang lingkup, jumlah, dan harus mematuhi protokol kesehatan. Pembatasan tersebut diimplementasikan dengan setiap penduduk yang harus bekerja di rumah dan beribadah di rumah, dan pemerintah membatasi mobilitas ekonomi dan sosial sehingga berdampak terhadap kehidupan ekonomi yang ada. Ini salah satu hal yang menjadi kebijakan-kebijakan daripada Bapak Presiden. Yang kedua adalah second policy adalah menyangkut ekonomi aspek. Jadi kami memberikan relaksasi terhadap berbagai regulasi ekonomi, seperti memberikan keringanan pinjaman bank, menurunkan suku bunga, ada diskon pajak, pembebasan pembayaran listrik untuk golongan-golongan ekonomi lemah. Dan terkait dengan logistik kebutuhan, serta bisnis yang terkait dengan hal tersebut. Yang ketiga adalah menyangkut aspek sosial, policy and the social aspect. Saya kira pembatasan sosial berskala besar dengan kebijakan-kebijakan transisi maupun bertahap itu telah membuat penambahan terhadap masyarakat yang harus kita perhatikan dengan baik. Kami memperkuat jaringan pengaman sosial bagi masyarakat yang sangat terdampak dengan adanya pandemi COVID ini. Dan kebijakan terus itu akan berupa bantuan tunai langsung dan bantuan pangan untuk setidaknya minimal 6 bulan ke depan. Saya kira ini yang menjadi prinsip daripada Bapak Presiden Jokowi yang selalu menekankan bahwa pada Juni 2020 ini diharapkan kurva jumlah yang terjangkit COVID-19 sudah mulai menurun. Dan ini harus secara masif dapat dicapai pada maksimal bulan Juli tahun 2020. Sehingga diharapkan pada Agustus nanti sudah dapat melakukan konsolidasi untuk kembali kepada kehidupan yang disebut dengan new normal, yaitu adaptasi kebiasaan baru dalam kehidupan kita. Saya kira new normal, Indonesia has prepared new orientation for various aspect of life is implementing health protocol, disiplin. Dalam tatanan kehidupan new normal, telah menyiapkan berbagai orientasi baru dari berbagai kehidupan dalam memberlakukan protokol kesehatan. Perilaku masyarakat harus kita disiplinkan dengan secara maksimal. Saya kira ini beberapa kebijakan-kebijakan daripada pemerintah Indonesia, concern daripada Bapak Presiden Jokowi, yang saya kira ini akan bisa menjadi bagian yang harus kita kembangkan ke depan. Kita harus mampu melawan hal-hal yang berkaitan dengan pandemi COVID ini. Ladies and gentlemen, speaker, saya kira ini yang ingin kami sampaikan, beberapa langkah-langkah periodik yang sedang kita lakukan. Terima kasih atas segala perhatian. Thank you very much for your attention.
Okay, thank you very much for the speech, Mr. Cahyokumolo. Now, before we start the panel session, we would like to have a quick photo sessions first with all of our key and reputable guests. Just to capture all the guests while they are still in their best shape. So please don't mind, sir and ma'am. Kindly please follow my mark. And to IT team, please help to capture the photo. We will have two gesture. The first one is just the regular natural smile. Okay, let's do that. 3, 2, 1. Okay, thank you. And the second one, can you please do a gesture like this? Yes, it stands for Terapan or Applied Science. This is where our moving forward for NIPA School of Administration as vocational school. Okay, in 3, 2, 1. Great, thank you. So thank you very much for your kind cooperations. Okay, moving on to next part, we will jump into our main programs. Is the panelist sessions from all of our 6 key speakers, which will be moderated by Dr. Cecep Effendi. But before I hand over the webinar sessions to Dr. Cecep Effendi, I would just like to read over a quick highlight of Dr. Effendi's profile. Dr. Cecep Effendi from Indonesia is the 7th director of CIRDAP since 2012. He is the successor of Dr. Durga Paujial. Dr. Cecep Effendi is an academician and activist. Dr. Effendi specializes in decentralization and democratization. He has worked in national and local government agencies in professional and advisory capacity. He served as a partner of Asia Foundation, program manager of decentralization of UNDP, and senior advisor of German Technical Cooperation's Advisory Service Support for Decentralization in the Indonesian Home Affairs Ministry. What a strong profile, Dr. Cecep Effendi. All right, I'm gonna hand over the sessions to you. Kindly have it your way. The floor is yours. Thank you. Dr. Cecep, sorry, you are still muted. We cannot hear you.
Okay, sorry. Before we proceed to our discussion, let me convey my sincere appreciations and deep gratitude to our ministers, Mr. Cahyokumolo, who still spent his time with us despite today's holiday, and also to the Honorable Chairman of Indonesian Institute of Public Administration, Dr. Adi Suryanto, MSc. Sir, both of you, thank you very much for your coming and opening remark. We very much appreciate your participation in this opening remarks, sir. Thank you, sir. Thank you, sir.
Thank you, Pastor.
Thank you. Let us begin by welcoming all our panel speakers for this afternoon discussions. And I'm very happy, not only because they are coming for our discussion, but also basically this is an old friends kind of get together. Now we are still having 2 more speakers who are still missing. I hope they can join us later on. But let me begin to welcome you all, the panelists and the participants of this webinar conference. Now, we know very well that COVID-19 has changed the way we live. You know, COVID-19 has changed the way we live. Until February 2020, nobody has ever thought that we will have this enormous problem. We will have these severe problems, pandemics that affect all of us, from the west to the east, from the east to the north, and the north to the south. Practically every country has suffered because of the pandemic crisis. The country from the developing countries, countries from the advanced countries, and most of the countries suffer from this one. The problem with this pandemic is that nobody can have any idea. Even the best university in the world are struggling how to deal with the situation, what kind of vaccine they can create to deal with these issues. Nobody has the answer even today. We are still hearing some innovation here and there, but no confirmed vaccine that have been approved by WHO. Pandemic basically has impacted at 3 or 4 levels. When the countries suffer from the pandemics, there is no other way they can deal with except by imposing limited number of rules, strict rules, to make sure that there is less activities of the peoples. We can call it lockdown. Some countries impose lockdown to ensure that there is less activities of the people, less interaction among the people, but lockdown has very serious implication. It basically closes all the economic activities of the country as a whole. As a result, most of the factories have to be closed. Most of the restaurant has to be closed. Most of the shop has to be closed. As a result, hundreds and thousands of people lost their jobs. So the effect of Corona, of COVID-19, that's not only a medical issue, but it's also an economic issue. At the same time, the government has to answer to the most damaging effect of Corona. People without job, especially those who live in urban areas, the lowest of the lower of the income group in the societies. When the factory closed, when the shops closed, when the restaurant closed, practically they lost their job, they lost their incomes. There is no social security for them in this kind of situation. As a result, they have to move back to their villages. Once the Prime Minister of Narendra Modi of India declared that from today onward, India will have to have lockdowns, thousands of people decided there is no other way to survive but to go home. But allowing people to go home back to their villages is also allowing the spread of the pandemics. This is the dilemma of every country has to deal with, even today. Now the problem is that we see a situation where some countries are very successful in coping with COVID-19 and some countries continue to struggle. If you read the media, you know very well that we can learn from the sad story of South Korea, from Taiwan.
Dr. Cecep?
Yes.
Dr. Cecep, I'm sorry,
Yes.
but for Mr. Cahyo Kumolo and Mr. Adi Suryanto, if you have other business, you may leave the room.
Okay.
It's okay.
You're welcome, sir, to leave, sir. You are welcome to leave. I know you have so many engagement. Please do. Please do. Thank you for coming. Thank you for your presence in this meeting.
Welcome, thank you, Dr.
Sir.
Cecep. Please
Thank
proceed.
you very much. Yes, please. Yes, please. Let me continue with this one. You please go, sir, if you have other engagements. Now, to deal with this issue, let's learn from the experiences of other countries. We have speaker from Korea who will share with us how South Korea has been very successful in dealing with this COVID. We also have speaker from the Philippines, our neighbors, who will still continue to struggle with the COVID-19. We also have speaker from India. You know, India is a massive country, and we can ask our speaker from India, Dr. Fasantris, to share with us the experiences of one particular state of India. We also have speaker from Indonesia, our own friend and colleague, Dr. Nulia Nurdin. We will begin by inviting Professor Yung Han to speak with us for 15 minutes maximum. then we can have a discussion after the presentation of the three speakers, and then we can allow the participants to submit a question, and we can read for them, and hopefully will be answered by our panels. Let's invite Professor Young Han. Sir, please share your South Korean experiences.
Directly start my, okay. So here, I'm sorry. I want to share here my PowerPoint. Up. Okay. You can see here my PowerPoint first.
Yeah, yeah.
So yeah, I want to shut my presentation because, but very important thing is 2 years ago, I published here by the OECD here, you see, I'm sorry. Yeah. I can see my,
yeah, yeah.
The last one, the name, the book, it's research report, national risk assessment is very new strategy and the framework for the disaster management, including also the pandemic. So you can consult this one, or I can give you my file made by PPT, PDF also. So in Korea, as you know, this is the smart quarantine framework shared by here. The Ministry of Health and local government also with the telecommunication company. We have 3 big telecommunication companies. So already 7 years ago, we follow, for example, when we are planning the night circulation bus, we collect all the digital information or the consumer's card usage or something by smartphone. So it's made by the one meter cube. Every 1 meter cube, we track all the smartphone usage. So we gathered information from the telecommunication companies, also we can make the 3T strategy. It means trace and traces and testing and treating. So 3 T's. It's made by the here under the Korean Center for Disaster, KCDC here. So I already sent the PowerPoint by the WhatsApp network. You can download, you can see. So this is the, you see like this. It started from the airport and national quarantine. Already we know many very high technology like the drive-through testing and walking through testing. So actual situation you see here. You see all the other things. Even until today, our total, the confirmed, confirmed patients is 12,000, less than 12, a little bit 12,000 here, June. June 29th. The confirmed cases, but the total deaths here, total deaths toll is under 290.
Oh, very small.
Yes. Yes.
Very small, yes.
Here's today's data coming from the Johns Hopkins University, United States, more than 127 deaths. And deaths 55, even the Brazil and Spain, the other countries. But our death toll is only under the 300. Okay.
Okay.
So many. Shortly, I show you some video, but the streaming is not good. But I noted all the website address, so you can consult. So here are some clip. The listen clip I show you first. Maybe I cannot how control my video sound, so you cannot hear maybe video sound. I will explain a little bit. This is the kit testing here. Like this, we test all kits.
Dr. Yang,
Yes.
we cannot see the video.
You can. I'm sorry.
We haven't seen yet. Are you trying to show it to us?
You cannot see?
Yeah, no, not yet.
Maybe you can close the presentation or minimize the presentation first.
No, that's my presentation, because I want to show the video clip.
We hear the voice, but no pictures.
No, you have voice but no pictures.
Yeah, I think so.
I'm sorry.
No problem.
No video.
No video.
I'm sorry. I'm sorry. Here.
Okay. Now we see the videos.
Okay.
No sound yet.
Yeah, no sound, no sound. Oh, sorry. So it's the test kit. Sorry. The PCL is we on the throat we detect.
Yeah,
So
yeah.
nowadays 30 minutes after we can find the result.
Oh, 30
Before it
minutes
was 6 hours later, but nowadays DNA analysis before the occurrence of the COVID-19, we have already the testing center all over the country, 220. It is because of the MERS before.
Yeah.
2015, we prepared. At that 2015, MERS comes from the East Asia. In that case, only Korea had attacked severely. At that time, more than almost 300 people died. It's the serious things in the world because of that MERS. So we prepared KDC, the control tower, okay, and test. That's why we well prepared. The second thing is the masks. We have we produced so mass of masks because of the dust fine come from China. So we can prepare all the masks. That's the second, our success factor, I think. Like this, the test kit. And another thing is every smartphone, in every smartphone, we have the signals from the KDC, okay?
Okay.
Every minute. And nowadays,
okay,
we call it here the digital advertising or digital signage.
Okay. Okay.
We call it ONTAC, online on contact. Short on ONTAC, all things on contact. Even government, when pronounce or announce the law regulations, ONTAC, all announcement is ONTAC.
Okay.
By smartphone, okay. And the other thing is, as you know, we use also a drone to disinfection, to make a disinfection like this. I'm sorry, streaming is not good. Just and nowadays always we have the like smartphone, small camera. We check all this entrance. And schools, we never lock down.
Really?
Every day we disinfect all sites.
Okay.
Okay. And second one.
Can you tell us more about how the peoples behave in South Korea? Are they very well disciplined? Are they follow all the government rules?
Yeah, just after I'll show you 2-3 minutes another clips, okay?
Okay.
Also on the street, you use the COVID-19. So always under the Prime Minister, we have control tower in the Ministry of Public Administration, where all disasters are controlled. Sorry. You can hear the sound?
Yeah, very little. You can hear, not so much.
On the street every day, like street.
Religious gatherings and daycare facilities are continuing. He also called on the nation.
Okay.
Yeah, this smartphone, we download our QR code. So in every big gatherings, where we checked by the QR code, okay? So we can trace all the people.
Okay.
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 So now it's open the question after we discuss, okay?
Okay.
That's all.
Okay.
But I'm sorry, the streaming is not, the video streaming is not so good. So
it's all right.
Just I'll explain by.
Now tell us more about how the people behave in South Korea.
We have always the normal life, never locked down, never self-confined. Only the affected patients, they're stayed in home during 14 days. That's all. But we always the same life. So that's the proof our economy not so aggravated compared to the other advanced countries.
Okay. It means that even during the COVID-19, people still go to the office, kids still go to school, nothing special, nothing changed in the way they live.
Yes, we open all the university and all the high school, middle school, colleges open, but when that affected case happens, all closed.
Okay.
During 1 week,
Okay.
and immediately we traced all the possible patients.
Okay.
Because we can testing a day more than 20,000 cases even.
Okay. Let's me move to another speakers. What I do learn from your experiences is that South Korea is very much depend on the level of technology that they have and the discipline of the people who follow the government's rules and regulations strictly, and therefore the government never had any idea to impose lockdown in Korea.
Yeah, I just want to underline one thing. Korea is already digitalized whole thing, and the smart city base is on the smart city or ubiquitous. That's why you can move quickly.
Okay. Thank you, sir. Let's move on to another speakers. Can you switch off the screen so I can talk to others? Okay, thank you very much for your presentation. We can have a discussion later on. Welcome to Dr. Somporon from Thailand and Dr. Durga from Nepal, sir. Welcome you all, both of you. Let me invite our big neighboring countries, India, to share the experiences of India in coping with COVID-19, because India is a huge country. I request Pasanti to speak much more practical, much more down earth, by sharing with us the experiences of one state of India, Tamil Nadu. One state of India has around 70 million people, so it's a big state of its own. Let's invite Dr. Pasanti Rajendran. Pasanti, time is yours. 15 minutes, please. Your speaker is not there. Your speaker is not there. Okay.
Can you hear me?
Let's move on to another. Okay. Can you speak? Pasanti?
Yes.
Okay, go ahead.
Good afternoon, everybody.
Good afternoon.
Good afternoon.
Yes.
Oh.
Okay. Let's Pasanti. Let's me move to another speaker while you repair your loudspeaker and prepare for the next round. Let me invite Dr. Eva Tuzon from Philippines to share our neighboring countries' experiences, because Philippines until today is still struggling with the same issue as with us also. Please, Eva, go ahead.
Good afternoon, everybody. I would like to share with you the experience of the Philippines, how it addressed the COVID pandemic. I have my PowerPoint presentation outline of what I've gonna share with you, and I would like to be brief as per your request of 10 minutes presentation. So the Philippines have its law, the Republic Act number 11469, known as the cooperation or bayanihan in our term, Filipino term, to heal as one act. It provides social amelioration program for families, sectors, and communities led by the Interagency Task Force for the Management of Emerging Infectious Diseases, or we call the IATF-MEAD. And these are spearheaded by the DSWD Social Work, the Department of Labor and Employment. We have the Department of Trade and Industry, Agriculture, Department of Finance, the Budget Management, and of course, the Department of Interior Local Government. Literally, under the whole of government concept, the Proclamation 929 series of 2020, Section 3, all government agencies and local government units are enjoined to render full assistance. And so this cooperation law or the bayanihan mandates for the realignment of resources, abandonment of projects for which they had been originally allocated in lieu of the anti-COVID-19 interventions. So we really have to modify. We are instructed to modify our budget for the COVID. Can you hear me?
Yes, yes, go ahead.
And of course, because of the COVID pandemic, we have to have the preferential option for one of the most vulnerable sectors coming from the Department of Agrarian Reform. And we thought immediately about the poor farmers. So to mention, I would like to share with you, popularize an equally important government intervention by the Department of Agrarian Reform through the Support Services Office, where I belong right now, evolved what you call Agrarian Reform Bold Move Project, which we call, in hindsight, more of a spiritual action. You know, we call it the Passover from the Bible. You know, you remember the story of those people, the Israelites, you know, having to be marked by God to be spared from the different plagues at that time. So we have the project we call the Passover, the Agrarian Reform Bold Move for Deliverance of Agrarian Reform Beneficiaries from the COVID-19 pandemic. What are these? These are practical interventions. Immediately, the president asked us, you know, to deliver, because we have the lockdown, you know, we have to stop dominantly almost our economic activities. And of course, the poorest of the poor are even more marginalized, like the drivers, etc., the fisher folk, the farmers. So we have to give them food, plus the hygiene kits, you know. We have to give them alcohol, we have to give them the mask, you know, the basic things like that. So for the medium term, we have we grab the threat or the weaknesses, transform them into an opportunity for the Agrarian Reform Beneficiaries Organization, the entrepreneurs, to deliver the food to the urban areas or to all the communities across the country. That the farmers grab the opportunity, you know, to sell their crops, the production, the produce, you know, and some livestock. And so we also give them, we continue to give them some kind of enterprise or livelihood chance for the farm productivity to be sustained. So we give them cash crops, livestock, and so forth, support for the farmers. And also, we recognize that during pandemic or any disaster like that, we have to support the women in crisis. This is in line and congruent to the policy on gender and development. So let me proceed. What do we learn? What did we learn from the COVID? You know, one, we thought that leadership at different levels is so important. I think all countries, all the head of states, like in our part, the President Duterte, Rodrigo Duterte, asked the Congress and Senate for emergency power. No, that's why the cooperation law or the Bayanihan Heal as One Act was legislated taratari in the Bangla, you know, very quickly. So to address the nation every day, is there like, you know, a diligent father of the nation. He has to listen every day, you know, to the interagency he formed. every day he has to have to address the nation. And then, of course, the government agencies and the platform where the people are, like Dr. Chachep and Dr. Durga, you would, I think, affirm that all of what the government, the higher up, are thinking, are legislating, the role of the local government units are most important because it is where the communities are, right? So the role of local government, very, very important. The second appreciative insight is about the role also of the private sector. Because you see, we cannot move because of the lockdowns, the farm produce and any other commodities, other products, without the role of the private sector, for example, the cold chain and logistics. They were given the task to deliver, they were given by the Department of Agriculture passes, food pass, so that they will not be stopped by the police along the road. They should not be hindered to deliver the basic food items, the medical items. And one and foremost also, before I forget, we gave importance to the what we call frontliners, like the nurses, the doctors, who actually across the world are most affected. Now, because we also have our own weaknesses. We don't, at that time, immediate protective gears, we may say, while we are prepared for any disaster, this one is really entirely different, the COVID, something we cannot see, and the scope is so global, it's not just but the country level. We know that. So another insight, sir, are the responsible role of the citizens to behave. You were asking Dr. Chechep how the people are behaving. In the Philippines, we recognize that citizens should be really responsible to observe the prescribed community, we call it community quarantine. And there are 3 types that evolve. The general quarantine, placing all the community at like seemingly a total lockdown, to the enhanced, because when we observe that the curve, is not really flattening, so the president asked that it should be the enhanced quarantine ECQ, enhanced community quarantine. And then nowadays, after 3 months of being a little bit lockdown, we now move to the modified community quarantines, wherein we in the government have to report back to our work, and we also observe that the BPOs, if they reduce the manpower, they pay 50% or 100% their employees. So that is being seen by the Department of Labor and Employment. And for now, what are the emerging moves, or we observe the emerging new normal? I think it is being thought of across the globe. So how do we move on to the new normal? If at that time we are just advocating healthy settings, I think after COVID, we have to move on into a heightened model of healthy settings. You see, I am at home, but I have to wear this mask. Why? Because all my saliva and everything will be sprinkled according.
Okay. Connection is lost, I'm afraid. Okay. Okay, connection is lost. Okay. This is the problem when we use technology. to organize our conference. Okay, so okay, it's very sad to see this one. She's about to complete her speech. Okay, let's decided that we have to move on to other speakers while we can come back to her again after completing the discussions. So Pasanti, are you okay now?
Can you hear me, sir?
Yes, very clear. Can you proceed further?
Okay. Good afternoon, everybody. It's 2:30 p.m. in India. Greetings from India. Let me present the COVID experiences from India. Yeah. So you can see that India has the largest number of confirmed cases in Asia. I was just listening to Korea, just 12,000, Indonesia, just 50,000, 3 times India's numbers we have now. Number of cases, it's the 4th highest number of confirmed cases. We have the 4th highest number of confirmed cases in the world. And the first case in India was reported on 30th January. And currently, that is today's data, by today's data, we have reached 508,953 cases. The active cases stand at 197,000. Recoveries 295,000, and fatalities 15,000. So actually India's fatality rate, you can see, is much lower. That's a little encouraging, but otherwise the numbers, the total number of cases is just spiking every day. The fatality is just 2.8 against the global total of 6.13. And if you see that most of the cases are, located in urban areas, and the 6 cities in India actually account for majority of the cases. The 4 metros, of course, the Mumbai, Delhi, Chennai, Kolkata, and 2 other cities, Ahmedabad and Pune. So out of actually only 1 place in India is free of the COVID, which is actually a very tiny island called Lakshadweep. It's a union territory, it's not a province. And you see, the one thing which is encouraging is India's recoveries are exceeding the active cases for the first time, reducing 49% of the total infections. So you can see the confirmed cases spiking. Today, actually, we have crossed today's rate of last 24 hours, about 18,000 cases. So it's really spiking a lot. But the recoveries, you can see, is in yellow. The active cases in blue, active cases rising. The recoveries actually were more than the active cases at one point of time on 1st June, but now again it's spiraling, the active cases. And deaths is very less. So what has been government's response is we had from the national level, we had a national 4 lockdowns, which ended on 31st May, and then after that, the lockdowns are only in those places where the cases are high, and we have started to unlock actually. With the unlocking, what we have done is, I think this is practiced in many countries. We have zonal classification, where the entire nation has been divided into 3 zones: the green zone, the red zone, the orange zone. And the red zone is the places or districts where the high doubling rate, which have high doubling rates and high number of active cases. Orange zone, of course, districts with fewer cases. Green zone, those with without any new cases for the last 21 days. We also have developed for the entire nation an app, mobile app called Arogya Setu. Arogya means health, and Setu is a bridge. So this application actually helps to help in contact tracing and containing the spread in the nation. Actually, the World Bank has lauded this early deployment of such technology by India to combat the pandemic. The UN and the World Health Organization also have praised India's response to the pandemic as comprehensive and robust. In fact, the Chief Executive Director of the World Health Organization has noted that India has tremendous capacity to deal with the outbreak because we have a lot of experience, eradicating the dreadful smallpox and polio. Now, coming to actually, because Dr. Effendi wanted me to focus on some good practice or how, the Kerala model, how the Kerala model has been very successful and talked about in the entire world. But I would like to compare it with the state where I live. I live in Tamil Nadu. So if you can see the comparison. Actually, the first case was reported in 7th March. And today we are having about, in Tamil Nadu, 56,845 cases. That is more than the entire country of Indonesia, including 707 deaths and 31,000 recoveries. And we are the second highest, in India after Maharashtra, in Tamil Nadu. And a lot of, and the situation is actually spiraling out of control. But just let's compare it with Kerala, which is actually now a model for not only for India, but for the entire world. I would like to present Kerala's model. Actually, in Kerala, if you see, the first case, was confirmed on 30th January. And the number of cases initially peaked to 266 on 6th April, before it started declining. And for the first time in 45 days, there were no new cases up to 1st May. But following the return of, the Keralites who actually migrate to other countries and other states, more cases were reported in mid-May with a single highest spike on 23rd June. So they have, as of now, there are 3,451 confirmed cases with 1,807 recoveries and only 22 deaths, which is 0.64% of the total cases.
Okay.
It's a very low fatality rate. Kerala actually has a fatality rate of 0.57, actually, sorry. And Kerala's success in containing COVID has been widely praised both nationally and internationally. So we'll see how it is regarded as a model because of the path-breaking planning and action that the government of Kerala actually undertook. Kerala took advanced action in preparing for a serious COVID attack even before the first case because it had learned lessons from the Nipah attacks that fortunately were geographically more confined and it was able to counter very effectively. Actually, the health department with this experience, of containing Nipah, used the same to approach the COVID infection. So as soon as the first case was deducted, elaborate contact tracing was done and put in form of a map. The health department acquired the skills for contact tracing, often in partnership with other agencies and individuals. And once the cases started increasing, the intensity of the contact tracing could also be scaled up through the process of learning on the job. This is what was done. And then another area of good performance has been the surveillance system. You can see right from February itself, health staff were deployed in 4 airports. Kerala has 4 airports. All the 4 airports, health staff were deployed to screen the patients coming from abroad. I think this is basically the difference between Kerala and the other states. The other states did not do this, and that's why the number of cases spiked in other cases, whereas in Kerala it could contain because it contained all the imported cases which were coming from abroad. On the ground, actually, the health government surveillance system took a community-based character. Actually, this was done in the airport, but in the community, the health department actually took up with the involvement of the elected representatives of the local governments, particularly the local panchayat, village panchayats, members of the self-help group actually called Kudumishri, which is very, very famous, world famous actually, women's self-help groups, and the citizens themselves. So since Kerala is a tourist state and has many people outside the country, it had to be careful. So attention has to be before spread across the whole state, including interior rural areas in view of tourist resorts in the hills and scattered nature of the non-resident Keralite population. So the police department also got actively involved in this process. And the other aspect is from the outset, the state resorted to dynamic planning, anticipating an extreme scenario. If you see the support for the private hospitals was sought and obtained, large spaces that could safely quarantine people, including both public and private hospitals, and as a last resort, even empty houses, actually, which are there in Kerala, because most of the people go abroad and their houses are available, they were mapped. And the state has identified about 100,000 hospital beds with potential for ramping it up to 200,000 in case of emergency. And the first case, the first fortnight itself, masks and hand sanitizers which had disappeared or become too costly were produced locally and were produced by the women self-help group members, the Kudumbishree teams. Then also, in fact, most of the entire treatment burden of the affected people, the 450 affected people, fell on the government health system. It was very surprising to know that, the health system was so robust that even 93-year-old man who was infected and 2 persons in the age group of 80 came out hale and healthy. So this is one area which needs a professional study post-COVID-19. And managing the spread also was another aspect. The state was the first one to come up with a separate law to handle the COVID-19 problem. The state resorted to lockdown and instructions to reach out, as Ms. Eva was saying. Every day the chief minister used to speak to the people and highlighting, how people are cooperating and reviewing those people who were not cooperating, but doing it in a very nice manner. So, and regarding the state's strategies for helping the hardship, because there was a lot of hardship, as Dr. Effendi was saying, that in India there was a huge, migration. The migrants wanted to reach their native places, and that was a huge problem, which created a lot of issues. So, many of the migrants were, from also up with a 200 billion relief package, 200 billion rupees, that is USD $303, and it put cash into the hands of the poor through social security pensions. Assistance from welfare funds was released. Interest-free loans to members of self-help groups were provided. The public distribution system was activated, and free rice provided to every cardholder, irrespective of the time. In addition, kits having essential condiments were also provided to the public distribution system outlets. And for the beneficiaries of the child care centers, their quota of food was provided at their doorstep once a week, covering, the adolescent girls, pregnant women, lactating mothers, infants up to 3 years, and children up to 3 to 5 years. And since Kerala has a large number of immigrants, about 2.5, as I was mentioning, special arrangements were made to provide them with cooked food or food materials as per their choice, because most of these migrants were from North India and their food choice is totally different from the South India. And so according to their choice, they were provided food. Nearly 20,000 such camps are functioning in Kerala. It is the largest in the entire country, this kind of migrant camps. And free food is also provided by local governments to those who needed it. This is done by the Kudumbishree members.
Hello? Hello, Pasantis? Hello? Hello? Can we come back to the screen again?
What members? Yeah.
Okay.
Yeah.
Yeah, please.
And yeah. So this, I would just like to conclude with one good, best practice that the Kerala government, one of local government, Kerala local government did. That is, they propagated the idea of social distancing at the local level, by using umbrellas. I think this got propagated in the entire country.
Okay, go ahead, Pasantis. Hello, Pasantis. Hello. Hello. Hello, Pasantis. Hello, Pasantis. Can we come back to the main screen again? Colleague from Stan, help us to come back because there's a missing connection now. Hello. Hello. Hello, Pasantis. Hello. Okay, thank you. Excellency Ministers, if you want to stay, please welcome. But if you have other engagement, you're also welcome. Thank you, sir. So now let's come back to Eva because we lost contact before she complete her speech. Can you spend time with us again, Eva, for 5 minutes to conclude your speech? Sorry, before that there was no connection with you. Go ahead, Eva. Eva?
The
Hello,
microphone needs to be on.
Yeah. Eva, your microphone.
I forgot. Okay.
Okay, please.
Yeah. So where did I stop, sir? When the internet.
Yeah.
If you could let me know.
I think you stopped when you talk about the lesson learned from the Philippine experiences, the private sector engagements in dealing with
I
COVID.
see. I was already there. Okay.
Yeah, okay.
So it's important on the role of the private sector. I was explaining that they have to deliver the food items and other products to the communities, especially the urban centers. You know, in the rural area, apparently they really don't have problems about food. But for the urban areas, they will be in trouble if there is no, if the role of private sector was not undertaken. So through cold chain and logistics, these products are sent to Metro Manila and to other cities. So also, we recognize that citizens should be responsible to observe the prescribed community quarantine, which there are stages actually from the general, and then when the COVID is getting high, the cases, so the president asked us to move to the enhanced community quarantine. And then when we observe the curbing, the flattening of the curve, then we move to the modified community quarantine, wherein the government sector is back to the the usual reporting time. So what now? And the emerging new normal. So we have to mainstream the heightened healthy settings. Remember the healthy setting model early on? So that one, that even staying at home, you have to use your mask when you talk in front of your laptops, if you are sharing your laptops with your family members, just like in my case. So we also have to understand the views of the economists, the economists or the business sector have to unlearn and dispel the dilemma of good Samaritans, going back to business or maintain that kind of charity to help people, who are marginalized. So another, in moving to the new normal, I think on the perspective of new or public management and administration, with this COVID, we have to have another round of theorizing. What would be, are the theories of the public, are we going back to the one best way? But we know what is the new normal, like what we are doing right now. Instead of the face-to-face international events, we have to go by this, the video conferencing and so forth. So
Okay.
I think these are the lessons that we have learned from the COVID, sir. So any questions you may want to ask later on.
Okay.
Thank you very much for listening.
Thank you very much, Eva, for your presentation. I hope we can connect with Prasanti later on, but now we have already had 3 speakers. I hope you can bear with us for some more speakers to come. We will invite our colleague from Iran, Dr. Sabas Hussain, to share the Iranian experiences. Iran is a unique in one way because he has to cope with 2 biggest challenges. On the one hand, Iran is continued to suffer under the American embargo. And the second one, the COVID is also another serious issue. So can you share with us your experiences, Dr. Sabas Hussein? Please spend with us 10 minutes, 15 minutes.
Hello, everybody. It is my great pleasure to see all faces of my old friends from different countries, specifically Dr. Cecep Effendi from Indonesia, Dr. Durga from Nepal, Vasenti, Eva, Dr. Sompron, everybody, others also. It is really my great pleasure to share some of the experiences that Iran is experiencing indeed with you, all of you. I shared my PowerPoint with the administrator. I'm just requesting if it is possible to launch it. So I don't know if they will do that, sir, or not. Dr.
Just go ahead to speak. We'll ask him.
Okay. As Dr. Cecep told that we are facing two big challenges, maybe not other countries they are facing. One is this COVID-19, another one is the sanction against Iran from the different countries, specifically from USA. So you know that actually in this situation, they have to, remove the sanction, because you know it is talking about the health and the health of the people. I can say 80 million people in Iran. So, but maybe it is also another chance to us that we do everything by our own. We produce all the instruments, all the kits, this medical kits I'm talking, and many other facilities. Okay, just if you go the second slide, I wanted to give you some daily confirmed infected by COVID-19 in Iran. You can see that it is started off in mid-Feb, and it still continues. In May, a little bit end of the April and just first week of May, we could, to reduce the infected people. But now I think we are just reaching to the second maybe phase that you can see that there's many new infections are coming. And maybe it is, that this all the shops and restaurants and many other service providers, they were closed. Almost it is 2 weeks they are just requested to open, but following the rules and regulations made by the Ministry of the Health, they have to open, and by some restrictions. Maybe it is the reason, the main reason to raise up the increase the number of the infected people. And the next one, if you see, it is the number of the daily deaths by COVID in Iran. You see, if you see the first phase, end of February and March, a lot of deaths we had in Iran daily. But now it is almost decreased in May, but still now we are just in the June already increased, and the government is a little bit scared just why this number also increasing day by day. So it is just some information regarding the daily infection and also death in Iran. Just let me go for the next slide. Yeah, so when they please push the button. If you know there is a process how to deal with the COVID-19 in every countries. So first of all, what the Iranian government did, they did a public awareness. The public awareness through the different models, different ways. First of all, they did on coronavirus. Really, what is the coronavirus to the people? So different ministries, different this TV channels, different journals, and this they talked about it. But later also they aware the people about the symptom. You know, it is a little bit look like a flu, so people maybe they are getting confused between the flu and the COVID-19. So then they just made some public awareness on symptoms, and also how to protect yourself from the infection. You know, it is a because it is a new virus, and sometimes also the way to protect yourself also a little bit was discussion among the specifically with the among the physicians and experts. So, and then if you infected, what you should do? Then there is a discussion on so many other things. The second phase, what this government they did it. They created a campaign that everybody should stay at home. So the slogan was we stay at home to save the others, to save, because I respect every others, then I stay my home. So then it was the another initiatives just taken by the government to regarding with the dealing with this coronavirus. And another one, this, you know, this actually maybe many countries, the government, they did the same, but in detail, maybe a little bit different, because, you know, suppose you can import some products from the different countries, but for us, it is difficult to import. Then we have to produce our own due to the sanction. Then the government support the factories, manufacturers to produce and also distribute the specifically mask and disinfectants, and also medical kits. You know, for the labs, we need a lot of updated kits. So then government supported to do some research and also to produce. And also, you know, this in every country it happened. Also, we paid the cash to the affected families, specifically who they lost their job. There was a website. They could come and just make a registration on the website, and then they can get the pension from the government. Also, this for the employment rate, and also another one very important initiative taken by the government in Iran. The COVID-19 treatment, it was fully free for everybody. There were specific hospitals to receive the people for the treatment. And another one that our government did, that almost 90% of the people were checked up through a website. There was a website, informed everybody. We went to the website and just there was some question, how is suppose my health condition. Then through this one, they could communicate with me. If I have a problem, they come to my place and check with me and by my family or this thing. Through that website just created by, generated by our Ministry of Health, almost more than 90% of our population were checked up, and finally they could find the people who were affected by the virus. Maybe in the next slide yeah. So you asked us to give you what is this central government and local government, how they could deal with this. All features, all initiatives that I mentioned, they just taken by the government of the central government. But you know, this in Iran we have this. It is not the state. It is the province. In our provincial level we have. So the provincial level and the central government, they have a little bit, what we say, tight connections. And other than the central government that they made some regulations and rules, local government also they did. for the all for the cities between the also this within the one province, they could control the passengers, so no passengers or just travelers, they can go inside. I mean that this local government also took a lot of initiatives to control and also to treat this people, this sick people. And another one that is in Iran, this a lot of NGOs, they took initiatives to distribute the masks or gloves or foods or different items to the poor people and also common people. Maybe you will be astonished to know that in common people, suppose if it is some town or some village, they couldn't allow the people, they couldn't allow other people to come to their town or their village. So they stopped the people and they checked the people if there was actually facility, whether the passenger, the traveler is okay or not. And they didn't allow to come to their area. So, and also private companies, they took a lot of initiatives to deal with this. But the main support to the government taken by our army, they could what do you say, set up big hospitals, big checkup stations in the different cities, different areas. So that's one army also helped a lot. And also the startup, this they did a lot of new systems to identify the coronavirus and also to share the some medicines, like some medicines they created, and also different departments, universities and schools, they took initiatives to deal with the coronavirus. Next slide. It is the photo showing that this distribution of the food and also healthcare packs to the poor people. And some lessons I wanted to share with you.
Hello, Sabas. Okay, we have another problem again with the connections. So I hope he will return to us again very soon. Well, while waiting for Sabas, we can return to. So Pasanti, I think you have already finished all your presentation. That's okay. So okay.
Yeah. If you can give me some time.
Yeah, I'll give you 5 minutes. Can you spend 5 minutes with us?
Okay, sir.
Okay.
I think I'm having some issues.
Okay, no problem. We can come back to you again. Okay. While waiting for Sabas to return to us again, let's invite Dr. Nurliah Nurdin to share Indonesian experiences in dealing with COVID-19. I think it's better to ask presenters to spend their time with us to present their information. Then we can have a discussion later on. So please, Dr. Nurliah Nurdin, time is yours. The microphone, please. The microphone. Okay. The microphone. The microphone, please.
Okay.
Okay.
I'm so sorry. Okay, thank you very much, Dr. Chacha, for having this having us to get together with this really international Asia Pacific overview and sharing of pandemic COVID-19. And thank you for Mr. Ministers for staying with us, and also Dr. Adi for staying with us for this international webinars. It's good to have a last speaker because apparently I have to cut some of my presentation after seeing others. I used to have like 18 presentation, but now I cut it off because I think I only have like 10 minutes to 15 minutes. So let me start with the question that has been given by moderators, that we want to share about how the state responds, and then how is the coordination of local governments versus central governments, and what is the best practices that can be learned from this pandemic. So I would just start by showing my presentation. Hopefully everyone can see. Can you see, please?
Yes, please.
Okay, great. So I would just start from the government response. The first announcements from the government that we have this COVID-19, it was March 2nd. So it was March 2nd. There were 2 cases that were studied in March 2nd. And currently it's spread to 34 provinces all over Indonesia. We don't have enough information the earlier of January, even in December or November, about these viruses. Either elites or society, they all undermine these viruses. There are some jokes hanging around, like we could actually cure these viruses only by having herb drinking, or because we have a tropical weathers, or we just pray at home, then these all viruses will disappear. But apparently it increased, and it makes more people really curious what's going on. So the government announced the government regulations in March 31st, which is start to restrict the movement of people and goods within a control zone. But it stopped short allowing regional administration to close their borders. Some regional provinces would like to have close to their borders, but there is a regulation from the central government not to close them. We have a lot of cases come, and then especially for the local government employee, because we are all here in this public administration, we're all government employee. What I can say that we start working from homes since a week after, a week or 2 weeks after the first case, which is March 14th, under Minister of Bureaucracy, which is our minister right now here. We work from home, and then he makes some regulation how to still keep performance of civil servants while they're doing their job at home. There's some digitalized performance that only be found during this pandemic. So this pandemic actually forced everyone to use technology. We don't have this meeting actually. This could be really costly to have this international meeting, only due to pandemic that we can meet each other. So in related to local and central government relations, after having this regulation that prohibited people to go further, the regulation also restrict the movement of people and goods within a control zone, but it also stopped allowing regional administration to close their borders. Why this has happened? Because we are united governments, Unitarian governments, the government concerned of the economy. Because once region close their borders, it will impact to other regions, and then it will be impact worstly to the lower level income people. And national police could take legal step against anyone violating the rules. As June 24th, a few days ago, the cases right now is increased to 49,009 cases that have been confirmed, 2,572 deaths, and there's a mistake written here. There's 19,000 already been recovered. Okay, so what is the challenge? What is the challenge between central government and local governments? The first challenge for central governments that people start to demand more reliable data and domain knowledge, because people really need information, what's going on, what they can do, what is the government do for them. So this is a demand, and this is a challenge for central governments. And second, people think that absence of legal measures of monitor responses from one province to another province, there is still a absence of legal measures. And also, people see the bureaucracy process inefficiently to mobilize resource. In the local government side, they tend to demand more authority to deal with the pandemic. Why is that? Because they feel that to ensure timely response to their local people, because province right now having direct elections, so it's a head of district, head of province feel more responsible to respond to their public accordingly during this pandemic. What is the lesson learned actually we have in this pandemic? Some cities, of course, not all of the cities, in the big cities mostly, there existing smart city governance and infrastructures. There's a key factor how Indonesia cities able to benefit from, because the government communicate better, especially at the local level and with their citizens, and build crucial tool fast. And there's a very important even national political event in Indonesia also postponed due to this pandemic, which is elections, which is simultaneous election is postponed until December 2020. So what the challenge for government and social and civil society? In the civil society perspective, they need more advocacy, they need more accountability, and they also need monitoring of daily based pandemic cases. And this is endorsed actually the government also to react more responsive to the society demands. And in democratic life, this is also promoting citizens' participations, because more people demand, more people request to the governments. And another is their demand for asymmetric of power between the executive and the accountability mechanisms. Like the government will share a lot of budget to help lower level income people. And people have to question how this could really going to the right person. They need accountability. And the more questions raised by people, it makes also government need to provide more technology to show people how all the help, all the funding of the COVID get through to the lower level people. Since there is a restriction of movement to prevent activities that require meeting physically, so people again demand for access for information. So this is a current challenge for a civil society that also force government to change the way they communicate with the people. It's a change the government to more responsive to people demand. I'll show you how Jakarta is the epicenter, as a sample, epicenter of a pandemic. There's a coordination between central government and local governments, but it seems that some provinces move further. They're doing a fast, accurate, and responsible response. Also trying to restore public trust and increasing the readiness of the people. As you see, Jakarta is the highest, still the highest numbers of cases.
Okay. Go ahead.
Yes?
Go ahead.
Okay. there's some surveys, because Indonesia do like surveys, who's performing better, you know. This is like a sample of other provinces also. There are 3 provinces in Indonesia that by median surveys thought to be appropriate leaders in handling COVID-19, which is in Jakarta, West Java, and Central Java. Taking example of Jakarta, this is I think a best practices that we could share. Jakarta implement the large-scale social collaboration programs. This is embrace a social accountability concept, which is the awareness of society to participate in the government decision-making process will affect their basic need. So there's some people actually want to help, but they don't know how to help others. And the government take a part as a provider, engagement provider for this. They call for open call, united to help each other during COVID-19 pandemic. What happened is that this program, the large-scale social corporate dashboard, there's a lot of multinational entrepreneurs and business association would like to take a part, and they were invited to take a part in providing assistance Jakarta affected pandemic by implementation of these large-scale social restrictions. Because you know, some at the lower level, this is kind of joke, but this is true. For those lower level people, they cannot say that I stay at home. They would say, I'm afraid. I'm more afraid of not giving my family any food than coronaviruses. So they have to go out. So this is the collaboration, the large-scale social collaboration come to help them. And it works because it's helped people to know their neighborhood, their district nearby, to help them with their money, with their packages, and then the data sharing by the government. And even the government has not reached the lower level people, these people contact, which is government already provide the central. They contact the government that I'm the one who also need this, and my name or my family is not yet registered. So I'm eligible to get this help. And this is really helpful. It doesn't mean that the government already put the responsibility to the society to help each other, but having this helping each other, collaboration of society is really a best example that we could learn from this pandemic. There are 5 opportunities. That's my last slide. 5 opportunities for civil society during the pandemic. There is an increased legitimacy of civil society. As I explained earlier, that people need more information, and it's forcing government also to provide more information. So there is a widespread engagement on these situations. And there is also exploring of platform for digital civic engagement, because everybody were asked to stay at home. There's no other way to contact each other, to share the knowledge, to do some opinions, to request for government, for request for a society need. They're doing this by digital. We call it as a digital civic engagement. So at the same time, there's increased information which is government provide on this. Local and central government work together to minimize the cases. At the end, this pandemic eventually building a new alliance. It used to be there is a disconnection between society, disconnection between society and government. Now they were forced to work together because one place get viruses, there's no other way that the other place will save. So this is a collaboration emerged after this pandemic. Then I think a best learning that we can have.
Okay.
Yes, thank you.
Thank you, Dr. Nulia. Can you return back to the main screen, please? We still have at least one speaker from Nepal.
So should I turn off my presentation so others?
Please come back to main screen. Yes.
Yes.
So I think we still have Dr. Durga with us. Where is Dr. Somporn? So now this will be most likely the last speakers. So I invite Dr. Durga to share the Nepal experiences in dealing with this COVID. Given the fact that Nepal is reliant heavily on its tourism sectors, it must affect the country very much. Sir, please, time is yours.
Thank you, Dr. Sesep. Can you hear me?
Yes, please, go ahead, very clear.
First of all, I would like to thank you for giving this opportunity to share our experience. And in fact, I missed the presentation of Korea because I was not able to fix the computer.
No problem.
But I could hear the presentation from the Philippines, from India, from Indonesia, from Iran, and it was really interesting and very good. So this subject is very appropriate, and as Professor Nurdin mentioned that in fact the pandemic has given the opportunity for us to share by by the computer. So this is in fact my first opportunity of such exchange of experiences. It was
great.
So thank you so much.
Thank you, sir. Welcome.
Let me first share my experience on Nepal. In fact, Nepal is the newcomer of this pandemic. We have almost about 10,000-11,000 of cases by now, and the death is below 30. So we are still moving. So and there are not any case studies that has emerged in Nepal as yet. Like Basanti presented the case of Kerala. So such successful cases has not yet emerged from Nepal. But before I make some issues of Nepali experience, let me briefly introduce Nepal, because Nepal is a little different country. It is landlocked, it is least developed, it is mountainous, and it has a vast rural areas and very remote areas. Now, the economy of Nepal is dependent on tourism and remittance. That means hundreds of thousands of Nepali workers are in the international labor market. So one of the big challenge of COVID-19 is how to bring our overseas workers back home. So that itself is a big challenge, and that may increase the case of the pandemic when they were at home. Now, when the economy is dependent on tourism industry and remittance, and when both are hit by the pandemic, COVID-19, I'm sure that the economy will have real trouble in the days to come. Now, in this background, what government has done in the initial stage is that it has followed the same principle that we learned from the West, that is lockdown, social distancing, hand washing, face mask, social distancing, and all. And one of the main problem is tracing and testing that needs a good health infrastructure and resources that Nepal does not have. Now, within the given resources that Nepal has, how has it managed? There are certain issues that we have seen in handling the COVID-19 pandemic. The first issue that we have seen is understanding the dynamics of the disease, what it is, how deadly it is, how different it is from the seasonal flu, how long will it last? Is it one season or it will continue? How the rural areas, rural people can manage their work safely. So instead of understanding these dimensions of the disease, the media rather emphasized and amplified by a different type of headlines and media coverage and all. So what happened as a result of that is that people are afraid. Health workers are afraid to go to the rural areas. Doctors are afraid to see the COVID pandemic cases. So that has really affected the already low health infrastructure that we have. That is one issue that I have seen at the earlier stage. The other issue, the second issue I have seen is the management of quarantine. As I mentioned that hundreds of thousands of workers are coming home from abroad, mostly from India and Gulf states, Malaysia, Korea and all. Now, first they have to go to the quarantine for 2 weeks, 3 weeks. And the quarantines are very badly prepared and very badly managed. They do not have running water, a separate toilet, health worker, So at the end of the day, what happened that the quarantine themselves became the breeding center of the pandemic, And we do not have the options either. So what happened that many of those who are suspected, they rather hide themselves or fled away and reached to their home in the village. So instead of containing in the quarantine, the disease went to the community because of the mishandling. The third issue that I have seen is the lack of regional cooperation or global cooperation. Because all the countries are busy managing at home in their own countries. But it has the regional nature. Many of the workers, as I mentioned, many of the workers are coming from abroad to Nepal. So they need to be contained where they are working, and they need to be contained at home in Nepal. Now, after some time, when the work will start again, they will go back. So maybe they will take the disease to the working area as well. So this kind of movement is essential when you have the laborers going to the international labor market. In this global, globalization, this kind of phenomena is usual. But I do not see this kind of regional cooperation or global cooperation on containing and managing these diseases. So this is another problem. And what we have seen, and which is very important, I would like to underline this, that the disease was in one place at the beginning, in January. Now it is global. That means the disease remaining anywhere can spread everywhere. Therefore, it has to be eradicated from all over the world. So that needs the global and regional leadership, which is missing at the moment. And finally, one is the problem that Eva mentioned briefly, is the creation of new livelihood and technology for generating rural employment. Because what happened that several industries, urban-based industries, especially the service industries, like tourism, transport, hotel, restaurant, you know, the shops and all are closed. And most of the workers have returned in the rural areas, in the village. That is the similar case has happened in the international market. The Gulf, the people from the Gulf where they were employed are returned back to the home. The problem is that there is no employment in the rural areas, and the earlier employment doesn't work. Now we need to think, what are the new technology, what are the new areas that these people can be employed in the rural areas, and they need to be trained accordingly. That how even in Nepal, I've seen that this earlier supply chain of producing at the rural areas and coming to the urban areas for marketing has also disrupted because of the lockdown. So how to make this alternative lockdown supply chain methodology? What are the new technology that would generate more employment for the rural people, and what are the new livelihood opportunities? So those things at this stage to address this COVID pandemic. So I do not have much sort of presentation at this stage, because we are learning from others and it is very early stage of Nepal. But I'm sure that when hundreds of thousands of workers will be returning from abroad and from India, I'm sure the number will increase steadily in Nepal, and Nepal needs to be prepared in a very low cost way, because we do not have much resources and infrastructure to deal with it. So thank you.
Thank you, sir. Sir, Dr. Dugal, can you just share with us one issue? Nepal recently transformed itself from a unitary state to a federal government, federal state. How this transformation also affect the capacity of the government to deal with these issues?
This is actually, we had decentralized system of governance earlier, and that had experience of 10, 15, 20 years. But when this new system has changed, it is only 3 years, 4 years old. So
yes.
I can say that confusion has increased rather than solution at this stage. Maybe when we go on and on, then because now the local government, I mean federal and local government are also very powerful than the earlier one. But how to exercise their power, especially on containing the disease, in sort of generating local employment, is still at the early stage. So it is not much clear. I think more will emerge in the days to come.
Okay. Thank you, sir. Thank you very much. Thank you very much. I think now we have times to have more deeper discussions among speakers before we allow people to ask their questions to this panelists. Let me ask just one simple question to Professor Yung Han. If you read the media, one of the key success of South Korea is because South Korea learns and prepare themselves from the earlier experiences in dealing with MERS, because South Korea suffered from the MERS pandemic earlier. So when COVID happened in South Korea, basically South Korea is ready to deal with this one. That's one of the reasons why. Is it correct?
Yes. Because it is we are learned from the past failure against the MERS, like a SARS. It happened SARS in 2001, and after another pandemic happened coming from China, it's the SARS, and the MERS is coming from the Middle Asia. Yeah, only is attacked to Korea, not Japan. So that pandemic was so serious for us, especially in the hospital. The big hospital, they cannot protect the circulation. The respiratory circulation is failure. Yeah. It's because this time the COVID-19 is so fast spreading, but the MERS not so spreading. But because MERS it's another respiratory disease, it's happened deep in the lung. Here, but the coronavirus is the upper side. Yes, it's because when we cough, it's so easily contagious. So it's very important thing is the wear the masks. So for example, France and Australia, the other countries, they export all the masks. They do not produce, even in Italy, they do not produce much the masks. But Korea, because of the dust, fine dust coming from the yellow dust from Mongolia and China, only we produce massively. It's the overflowed our masks. That was the good point for us, fortunately.
Okay, now let's move to the Philippines. Ms. Eva, I think your president has the reputation of being a very tough president. You know, he has imposed a number of very strong policies. He got criticism from the UN. Now, to what extent his strong position and strong policy rules also help Philippines to cope with this situation? To what extent that his style of government, style of ruling has enabled the Philippines to deal with this COVID pandemics better than in other countries?
Yeah, you must have heard or watched in the news that the president immediately asked for emergency power from the Congress and Senate so that he was able to legislate immediately the Republic Act on Bayanihan. It means cooperation to heal as one. And then we move on 3 months, stage by stage, every day. President Duterte himself monitors the implementation of the social amelioration program, you know, that the agency are doing their job, because if not, you know, President Duterte.
Okay.
Yeah, like that. He even said, kill them if they will not behave. But that's just, but you know, like a dad saying, you shut up, chup kare. Oh, he is like that. But otherwise, the president have shown that kind of affection to the Filipino nation, both power and the heart.
Okay, thank you. Dr. Nuria, can you share with us the way the Indonesian government deal with this one? If you compare the number of people who is dying from COVID in Southeast Asia, Indonesia, I think, suffered the most. We have the number of mortality rate due to COVID-19 compared to other countries. If we can believe the data from other countries, I think Indonesia has the largest number in Southeast Asia. Can you share with us what is the reason behind this?
Okay, thank you. I would say that there is no single government in the world who is really ready for this pandemic. Even the World Health Organization, and neither Indonesia. Unluckily that Indonesia, as mentioned earlier, we underestimate this pandemic. We are so self-confident that this is not going to come to our country. And especially there is some remarks from elites, even from society. They just make this is like a joke. And they were come to be really believe that this is really happened when the government, the president announced the very first time, March 2nd, that there's already cases, 2 cases at the time. And then it reached 1,000. After 1 month, it reached 1,000 numbers. And that's what I mentioned. Some provinces already prepared, actually. At the local level, they already prepare before all societies realize that. I've read some provincial what they have done. Taking example Jakarta in January, before even found there's a cases, Jakarta base already talk with doctors, with medicals, how do they prepare themselves if this is really come. In Surabaya also start to buying a lot of masks. Some provinces also trying to close their border. So they act profoundly before this pandemic announced. But again, we are really not that ready as other our neighborhood countries, Malaysia, Singapore. When the first cases came to them, we are not really like preparing ourselves. How if, and then this really become a sucks when the first case come, and then what I can learn from now that this is a global world right now. Whatever happens in other countries, it might happen in the short term to our country.
Okay.
Yes.
Thank you very much indeed. Pasanti, are you still there?
Can I?
Yes,
Can
sir.
I?
Yes, sir.
Yeah, please,
Can you
Durga.
hear me?
Go ahead.
Can I just raise one issue for other friends also to respond? I do not have very firm statistics from Nepal, but what is there in the news is that the statistics that the government has given, nobody believes. They think that the real number is much bigger than what they are saying. Because as I mentioned, in Nepal, it's very early and the number is very low, but people don't trust that the statistics must be higher. Is it the case in other countries also? That is number one. Number two is that as a result of COVID-19, other diseases have suffered. So the death from other diseases might have increased because the whole resources and attention has gone to COVID-19. Is that the case in other countries as well?
Okay, let me just follow up the question by Dr. Durga. There is a question here from Indonesia, from Bandung. I think I would like to request Eva and Yung Han, maybe Sabas if still around, or Pasanti still around, to respond to this question. What is the effective way to build the trust of the people to the governments? Because in most countries, people or public in general have limited amount of trust. They don't trust the government fully. Can you respond to that before you go ahead with the second question by Dr. Durga? Yung Han, can you, Eva, please. Eva,
Dr.
please.
Chachap,
yes.
Thanks for the floor. I have here my son, you know, and he was kind of telling me, Mama, Mother, you should be able to share also what seemed to be the weakness of the government. And sir, that is actually trust.
Okay.
I think all people across the world, even America, for that matter, every citizen doubts Trump. Here also in the Philippines, they doubt the president.
Okay.
The authenticity.
Okay.
Why, sir? I think the challenge is our data system. Yeah. When we are implementing the social amelioration program, including the Department of Agrarian Reform for the last 30 years of implementing agrarian reform, we found out, sir, that we missed the big data. Are you telling the truth or not?
Yes.
Simply because we have suffered targeting who are really the poor, who are really supposed to receive the social amelioration fund. So that is the, you know, why people are losing the trust in the government, simply because of poor management of our databases. And that is about big data.
Okay, thank you. Yung Han, can you respond to this question before?
Okay.
Abbas.
Sorry, I answered to the question.
Yes.
No, I mean in the bottom. So maybe it's the government interest in Korea because of the coronavirus, the good measures. Our trust in government, the index statistically research conducted by the Swiss country, and now recently show this highly we trust in government. It's because since 3 years ago, candlelight revolution happened. That's the why. And far advanced, we go back to past. It is because of the digitalized. All things are almost digitalized.
Mhm.
There's a advantage and disadvantage. Advantages is now we see many convenient things. In a minute, I'll show you by PowerPoint all the photos after how we prepare the post-COVID-19. That's the one thing is for the advantage, digitalized whole thing. I said the smart city, it is so complicated, but already, for example, on the street, we see when come the public buses, and all things are digitalized and informed to the public. Even when happens so remote area, there are some earthquake or some even small latitude of earthquakes, we can be informed, or accident also we can be informed by the smartphone alarm issued by the government. So all prepared already. Yeah, that's why. But disadvantage always there are so many digital. How can I say? We lost bank some the cyber crime so high. So the public, if we don't pay much attention to the digital devices, yeah, sometimes many information, private information is leaked. That's always the problem. Even our banking accounting number is leaking sometimes because so many hacking. The hacking problem we cannot solve wholly, but in this a little bit confusing age, the digitalized is a little bit good. So we prepare now post-COVID digitalized stage.
Okay, okay. So I believe that your current government has a highest degree of trust by the public, because you have a very popular president currently in Korea. Sabas Hussein, yeah. Can you share with us how big is the trust of the public to the government in Iran? Does the people trust the government's data, information?
Yeah, actually it happens in many countries. Just now there is a trust is every day, just reducing day by day, and in our case also. But since this experiences mean that dealing with the COVID-19, the government really did a great job. So now we trust to the data coming through the government, and also services coming to through the government. But the problem is here that how long people can wait. Just government just requesting people to stay at home, but how long they can stay. So this is the problem because of not the government. This is the problem of the income. This is the problem of the daily substances. So, but in general, so the trust is not that much in common, but in this experience, this government did a great job, and the people trust, I can say, increase.
Okay. Thank you, Sabas. Okay. We basically.
Can I come in with India's situation in
please
India?
go ahead. Where is your camera, percentage?
Yes. The camera is not working, so let me just speak.
Okay. No problem.
Actually, every day the health ministry, the central government, they put out the figures, and the state government also does that. But people especially the educated people, those who are aware, they take the figures that are put out by the government, but they have their own doubt because India is so huge and the testing is not happening. So are these the actual figures or number of cases that are there in the in the society? So this is there. And but if you see, as you said, it depends on if you see the Kerala government.
We miss her again.
There is a difference. Yes.
Okay.
There is a total trust in what the CM of the Kerala government shares with the public every day. There is no hiding of facts. Everything is put across. We have to tackle it. The government has to tackle it. And the people have to tackle it, and they are doing all the tests. Everything is being done, and that's the people's trust in the government of Kerala. But it's not so in with the central government or even the state government of Tamil Nadu. People have a doubt whether this is the number. The testing has just started, and so whether what the government is sharing, and especially in the city of Chennai, where the daily numbers are it's about now it's touching the daily numbers are touching about 3,500 to 4,000.
Massive.
So whether these are the actual figures and whether there are more out there who are not tested and actually declared, because there's so many people who are not coming out, and as somebody was sharing, with the fear of being quarantined, because the quarantine facilities are not good, and there's so many other issues.
Okay, thank you, Vasantis. Let me go to Dr. Nordin. Can you tell us a bit about how the people look at the government, especially the president? Before the COVID happened in Indonesia, I think majority of Indonesians feel that they have a very nice president, very sincere, very hardworking, and they believe that he will do the best for the sake of the country. Now, do you think that the public in general, the people in general, still has highest degree of trust to the governments today after the COVID affect the countries?
Thank you, Dr. Cecep. I think Mr. President needs to work harder on it to show that what has happened is unplanned. The whole world is busy with this, and step by step, all the donors, all the money going to the villages, it needs to be strengthened. That is really a kind of attention from government to make this. And to prove it, that the government already make we call it Satuan Tugas. There's a team, a special team, from national level to provincial level to district level, to deliver all the help, the money, any package to the lower level income. And the challenge also, because we're going to have a simultaneous election in this coming December. This is a big challenge for government to proving that this won't be used as a campaign tool, especially for the incumbent. This is a big challenge. But since society awareness increasing in this pandemic, it's going to be like a watchdog for every government's action, for every government's program. And we're working on this. We're really working on this democracy thing and in this hard situation.
Okay, thank you, thank you. I think we still have time for our discussions. So let me read some of the questions that people sent to us from Indonesia and abroad. One question's asking this: what is the best way, what is the best models that we have so far to ensure that COVID-19 can be dealt with the minimum amount of costs, while at the same time maintaining economic growth? I think the dilemma of having this lockdown on the one hand and also, allowing the economy to grow is another hand is always a difficult choices. I think I would like to learn from the experiences maybe from Iran or South Korea, how they deal with this one. Korea never practically imposed lockdown, so there is no issue of that. But can you tell us, so far, how is the government working? Is the economy still moving fully, or because of the COVID, they also have to, to deal with very serious economic crisis?
Okay. Here I prepared a brief some photos. I'll show you. Okay. You see the PowerPoint? My PowerPoint?
Yeah, I saw it. I see.
Yeah, it's the our policies: test, trace, and treating. 3 T's. Like I said, coronavirus. We have the testing more than 200 local clinical centers already. Equipped automatic mechanisms. Already we prepared 2 years ago or 3 years ago's failure. That was our lesson learned from the past failure. Yes. And now driving through and a kind of a walking through here, testing, tracing, and now we average it happened always the 15 cases, but 1 month ago and one and a half month ago, 0 cases happened, but since then, because social distancing, we never social distance daily life, only we manage the daily life without paying attention to the social life. That's happened. We made always the 15 cases, but nowadays we tried always it's the still applicable, and also in the future also we use that practice, that policy. So it's for example, in school, before lunch it was like this, but nowadays always packed in vinyl. And there's a private protector also, but in restaurant, no, never protected, only for the children. Yes. Okay. And also always the problem is like a church or mosque. So many people get together, always pray, or calling center, they work together, always get closer. So we changed walking home, many things walking home, because our Wi-Fi so fast, and we use 5G, not 4G. That's another. And also the control here, you see the control QR always now. And even we open the nightclub, there are so many infected cases happened. So from then we use QR code, yes, or it's easily tracing all the people. Even we can, or you can use Facebook also for tracing, like this here. Yeah, it's the photo from the Facebook mark the maps, the trace. So online booking and the medical consulting always happen. Yeah. And we said digital signage, uncontacted public communication. Even local government, if they something to let the people know, we issued by computer or digital signboard or all the signs. Yeah, we use. So we do not necessarily go to the local office, never other places. We use all digitalized things, even robot. Yes.
Okay, thank you. Thank you, Dr. Han. Let me just read one final question from the audience. Every country has its own local wisdom, okay? And to what extent the local wisdom help the country to cope with this COVID-19? Let me just rephrase the question. Philippines is the most devoted Catholic countries, maybe in Asia, and Iran is the most devoted Muslim countries. Now, my question is that based on the question from the people, who sent this question to me, is to what extent that this local wisdom, the religious factors, help the country to deal with this question of COVID, because I don't think the country has ever experienced this kind of the scale of the pandemic as big as this one. Okay, can I repeat my question? To what extent the local wisdom, the religious factor, the cultural factor helps, especially Iran and the Philippines, even Nepal also can share with us to deal with this issue? Can you begin with Eva? What is the role of the church, especially in the Philippines?
The role of
the church, the Catholic church, yes.
Oh, actually, sir, we have this executive order anti-terrorist local communist ending, something like that. And the role of the church is being called, you know, so that they will always remind that the law should be imposed in light of not just but morality, but to be observe the human rights, you know, so that the church sometimes is being accused of protecting, you know, the activist, the left-leaning citizen, but actually the role of the church, because we are basically a Christian country, we really have to, you know, the basis of human rights is one humanity. I think so. It's a universal value.
Okay. Can you share with us, Sabas, the Iran experiences? How the mosques?
So it is a nice question. So coming to Iran, indeed, you know, during this this experiences COVID-19, the all mosques and this all shrines, all praying room, all were closed. And actually, there was also discussion that, you know, many people, they believe that if they go for praying or just praying to Almighty Allah and this thing, God will save them or like this. But then there is a discussion, which one is better, science or religion? So there is a discussion among the scientists and also religion. But finally, everybody accepted the science is better, you know, this kind. Then they close the mosques, they close the shrines, they close all praying rooms or this thing, and just, you know, just to keep the people far from each other, not to going to place. And also for funeral ceremonies, people, they didn't attend also, you know, in Islam we have to go to the graveyard and this thing. Also the people, they didn't attend that. So in this kind, I could say that this really people listen to the central government, just requesting them to respect the guidelines coming from the scientists, not from the. But indeed, the religious leaders also, they told that this we have to follow the physicians and scientists. Right.
Okay. Thank you. I just want to invite one last comment from Dr. Durga.
One question I still have, one question for our common discussion, I think. Can you hear me?
Yes, please, sir.
Okay.
Our time is short, sir. Please, briefly.
Yes. One is that in the past, one of the big problem now is how to revive the economy. And in the past, the safety valve for reviving the economy has been the donors' money. Now, when the donors themselves have suffered globally, how do we see the scope of South-South cooperation for, you know, reviving our economy from our own, you know, mechanism or cooperation? How do others see it?
Okay. I would like to send this question to Dr. Nurdit. Maybe you can share your ideas what to do with the South-South cooperation. Can we say that we do more or what? Can you tell us what is your perspective on this issue? Yes.
Because earlier we used to get a lot of money from the Western donors.
Yes, true.
I think now the Western donors' money will not come as earlier. So there should how to fill the gap.
Yes, this. Dr. Nuria, can you share some of your ideas?
Excuse me?
Can you share some of the issue? How to do more among South countries, given the fact that we cannot expect money coming from the developed countries anymore because they also suffer from the COVID. So the only way to cope with this issue is to do more cooperation among the South countries. Can you respond to that?
Exactly. Thank you, Dr. Cecep. I think having this international webinar among Asia Pacific countries, it should be like a sign that we should, all of us together, work in hand together. And this virus is not attacking only one country, it's all countries. And we have to cope with our situations. And then what is our potential economic power that can be shared? Because this is really attacking our economic life, either countries, many countries. So what can we do actually working on this and sharing experience, and then what can we learn from each other? We learn from, for example, from South Korea, which is developed sophisticated medical treatments that probably it is quite difficult for us to follow them because we don't have that adequate equipment for healthcare, for example. But then sharing the information, sharing the treatment for the patients, and also to empower economy, because you're the example, Professor Yang, to do not have the lockdown immediately, because we see that South Korea saving the economy, there is no lockdown, but we still far from that kind of high technology to prevent that. And I think this is really a start, Dr. Cecep, that we could share, and then it's not only seminars. I think we could come with a policy brief. How do other countries work together to cope with these problems, international problems? Thank you.
Okay, thank you, Dr. Nuria. Yes.
One word from
yes,
me.
please.
Unfortunately, WHO at the first initial stage, they had no good information. Still now, we don't know exactly what the coronavirus is, how they spread, how fast they contact. Until now, if I briefly say the coronavirus, the more important thing is there's no any symptoms, especially for the young generation. So they have to pay much attention themselves, not to infect to their parents or the elderly people. We have to inform that kind of exact information to the more young generation. And also we need always wearing mask. It's the best way. It's not for protect us. First, the patient or possible patient, they can protect not to be contagious to the other people. It's very important. That's first things. Until now is the very sure thing is not wearing, not to protect us, but the first is the possible patient have to wear. In that case, we don't know who is the possible patient. In that case, it's better to wearing mask and distance, minimum 1 meter or 2 meters. Nothing than that measures, I think.
Okay. I'm afraid our time is up. It's already 5:30. Now, let me give you some very brief conclusions. The first ones, I think no country is ever prepared for this kind of COVID. Not a single country prepared themselves for this COVID. What they have is the experiences of the earlier pandemic. South Korea, Taiwan, they learned from the experiences of MERS, And learning from the experiences, learning from their failures in the past, they are well prepared to deal with COVID. That's why one of the reasons why they have been very successful in dealing with this one. But South Korea, of course, is different from India, different from Nepal, different from Indonesia. So basically, every country has to deal with their own internal situation. And when they're dealing with this internal situation, there is no guidance, there is no learning process, you know, because even the advanced countries like United Kingdom, like USA, they themselves find difficult to deal with these issues. So what happened is that the country is where they are best in everything. They also best for dealing with this one. South Korea, for example, the most efficient, the IT-based countries, you know, they're good in many ways. So when the COVID happened, they're also good in dealing with this one. The countries who are not good in many ways, they're also not good in dealing with these issues. This is the second one. The third one, I think most of the countries facing very difficult dilemma. You know, controlling COVID on the one hand and allowing the economy to grow on the other hand. Now, as a result, despite the fact most of the countries is aware that COVID still, you know, a big problem, the people still suffering in the large numbers, most countries, you know, impose the lockdown, the limitation only very, very shortly, because they cannot deal with the economic burdens of the people. As a result, COVID is still there even today, and the number is still big, you know, increasing day by day. The last one, I believe, different from other pandemics, there is no international cooperation, like Dr. Durga mentioned. There is not very much, you know, close cooperation among countries. I do not even hear or read the news that there is a big Asian meetings among the health ministry of the Asian countries. How ASEAN countries can, you know, share together the burdens of this COVID. As a result, basically, members of the Asian countries do their own way in dealing with this one. The last one, and the most critical issue, is that the COVID really a big test for the country's capacity to deal with this massive scale of pandemics. You know, infrastructures in most countries is overstretched. Hospitals find difficult to cope with this one. As you all know, even the doctors, the nurses, they also become the victim of this COVID-19. So I believe even if the same situation will happen again in the future, I think most countries will be much better prepared compared to the current situation, you know? So let me conclude with these ones. And on behalf of myself, let me express my gratitude to the panels, to the speakers, to the staff of the STIA LAN, and of course, especially to the Excellency Ministers and Honorable Chairman of the Indonesian Institute of Public Administration, who opened this discussion and stay for us for a while. Now, before we conclude, close this session, let me invite Dr. Nurliah Nurdin, who actually the host of this event, to express her thanks and appreciation to all of us. Nurliah, please go ahead.
Thank you. I actually need to thank Dr. Chetia for make this happens, the gatherings for all of us. Thank you, Professor Yang. I think this is
thank you so much.
And it's going to be a continue for sure. Thank you, Dr. Eva. Thank you very much. Even though you're wearing the mask, we can see still your beauty from the distance. Thank you, Dr. Durga. It's really nice you keep wearing the hat. I love that hat. Yeah, it's really special, yeah? Yeah. And I can see, because even though the video is off, but thank you very much for Dr. Fasanti. I'm sorry that you're not showing at the flyer, but you're attending this. Thank you very much. And then we actually have Dr. Shabab Hussein. Thank you very much. Most people really would like to have your opinion after Dr. Cecep say after embargo from US, you have suffered a lot of than others. And thank you very much for being around us.
Thank you very much. Thank you very much.
And the staff. Thank you, the staff.
Yeah. Not at least all the staff, all the lecturers who already prepared this for only 1 week, this kind of international gathering. Thank you very much. I think we should give a hand to you. Thank you very much. I cannot say any more words. Again, we wish we could learn a lot from this situation. It's engage us each other to be more cooperative. It's give us a learning lesson that one case it could affect others. We cannot just be silent and seeing others be affected. It's all our responsibilities. And then I think this pandemic, we learn really a lot to be work together. Thank you, Dr. Cecep.
Thank you. Thank you very much. Thank you to all. Thank you to the participants. And hopefully we can soon meet again to discuss another issues, another experiences to share with all of us together. Thank you very much. Stay safe and have a nice journey back. Thank you. Thank you very much.
Thank you very much.
Thank you very much.
Thank you,
Thank you very much,
also, Dr.
everybody.
Cecep and
Take care.
everyone.
Bye bye.
Okay, thank you
Bye-bye.
very much for all of the speakers, such a soundful
Bye-bye.
presentation and discussion sessions. We gained so much in the past 3 hours or so. We as the committee would like to give greatest appreciation to all of our speakers and attendees who have stayed until this long, especially in your weekend time. And then to all remaining audiences, please fill the list of attendees in the following link to get your e-certificate later. To IT team, please help to share this link.
Yeah, it's there.
Yes, this one.
Mm-hmm.
And also, you can access the presentation materials in this Google Drive link. I will give you 30 seconds to screen capture the link.
Yeah.
Okay. This attendance list can be accessed by both of you in the YouTube or also in the Zoom meeting channel, so you can both have the e-certificate later.
Okay.
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 Okay, now, okay. Thank you. That's a wrap. We hope you found this event informative and useful. Once again, on behalf of the committee, thank you all again for spending time with us today, and our apologies for any shortcomings for this event. Good evening. Thank you very much.
Bye
Thank
bye.
you so much.
Bye bye.
Bye bye. Bye bye.
To committee, please stay. Please stay.
Thank you.
Thank you. Thank you so much.
Thank
sir.
Thank you. Thank you.
Thank you.